Sir, the government is fully committed to doing more to improve mental health and well-being. But we cannot make this happen through policy alone. Our attitudes, our mindsets must also change and align with our shared aspirations for a refreshed Singapore dream. Our plans are not static. We will continue to evolve and update them, including taking on board the many useful suggestions from members in this debate. So let there be no doubt, the government is making mental health and well-being a key priority in our national agenda. If not addressed well, poor mental well-being can also affect our ability to lead our lives productively. And because mental health issues lie on a spectrum, it means we need a broad suite of solutions. So improving mental health is not just about hiring more psychiatrists or building more capacity at the IMH. We certainly will do that. But we also need to strengthen capabilities across our entire spectrum of care, including at our polyclinics and GPs, and across other settings like schools, workplaces, and the community, so that more timely support can be rendered to those in need. And let me highlight quickly several key moves we will be making with several targets we aim to achieve by 2030 or earlier. We will increase capacity at the IMH and the redeveloped Alexandra Hospital for those that need specialist care. Capacity at long-term care facilities will also be increased to provide step-down care for those who need it. We will increase the number of public sector psychiatrists and psychologists by about 30% and 40% respectively. We will introduce mental health services to all polyclinics and 900 more GP clinics. We will equip and train an additional 28,000 frontline personnel and volunteers. They serve across our community and social service touchpoints so they can identify people struggling with mental health and offer early assistance. We will also redouble our existing efforts. MOE is on track to achieving its target of deploying more than 1,000 teacher counselors across our schools. And this is on top of the basic counseling skills that all teachers will be trained in, as well as the 1 to 2 counselors that every school will have to support students with more challenging social and emotional needs. We will provide parents with resources to support their children's mental health and well-being needs. We will establish more peer support networks in the community, including in schools, institutions of higher learning, workplaces, and amongst our national servicemen. These networks will have trained peer leaders who can spread the message on the importance of mental health and provide a first line of response to their friends or colleagues who need help. These are significant moves. They will require more coordinated efforts across the government, more training, more people, and ultimately more government spending. But we will set aside the resources to advance this important agenda. Through these moves, we aim to reduce waiting times and make mental health services more accessible and closer to where individuals are, be it at homes, schools, or workplaces. We aim to keep mental health services affordable, and we will do so through our national healthcare financing framework of government subsidies and the 3 M's, which will cover all cost-effective mental health treatments. Importantly, no one in Singapore will be denied access to appropriate care because of inability to pay. Life insurers in Singapore have in fact offered coverage to persons with mental health conditions. But the underwriting of such persons can be a complex matter as our own data is limited, and insurers here typically reference the underwriting guidelines of global life reinsurers. So we will study and review how this coverage can be improved and ensure that financial institutions deal fairly with all their customers, including those with mental health conditions. Importantly, we will have a bigger focus on preventive care so that everyone can take proactive steps and take charge of their own mental health. Sir, the government is fully committed to doing more to improve mental health and well-being. But for all these plans to work, we also need to change our attitudes and mindsets. We need to do more to destigmatize mental health conditions so that people do not hesitate to seek help. The government has set out clear plans and deliverables, but the issues are complex and we do not have all the answers. We want everyone on board so that we learn together and continue to fine-tune our strategies based on your feedback and ideas and our shared experiences and insights. Together, let us build a Singapore where everyone matters, where everyone has a place, and where everyone belongs. Together, hand in hand, let us improve the mental health and well-being of all Singaporeans.